head out with Mary right now. She's in the lobby with a guest.
Well, good, because I'm cold. I could warm up.
One of my favorite people is here. This is Dr. Brett Parkinson. He's the head of breast imaging services for Intermountain Healthcare. And you have a new technology that helps you see things better, right?
Right. And what you're
Tomosynthesis?
Right. You're referring to tomosynthesis. And tomosynthesis is both a conventional 2D digital mammogram and a 3D digital mammogram. Let me explain. When we do mammography traditionally, we do we do two views of each breast.
Right.
But those views are two-dimensional, and we can miss things because of overlapping tissue.
Yeah, and we just saw an example of what it was less clear on the regular mammogram, but more clear on the tomography.
Right, but with 3D tomosynthesis, we acquire multiple images of the breast from different angles, and we take those various images and we synthesize them into 1 millimeter slabs. And so we look at each of those individual slabs.
It's like an MRI.
It's like an MRI or a CT. And what it does, it allows us to see each individual slice without the overlapping tissue. And of course, one of the reasons that we do miss things with conventional mammography is that they are hiding behind overlapping tissue.
Right.
And this actually allows us to see each individual slab. The nice thing about tomosynthesis, we know from a lot of peer-reviewed studies that have just been released, that it increases the cancer detection rate in the general population, and not insignificantly. In addition,
and we only have a little bit of time left, but I had it done the last time.
Right, you did.
As my checkup, and it was just like a mammogram. You didn't have to go into an MRI machine. It's not as expensive. It was easy. I mean, it just took a few more seconds of the view, and you can look at it instantly as soon as you're done.
That is correct. And the patient herself doesn't know that the tomosynthesis is being taken, except if she notices an arc go by that moves through, and that is acquiring those additional images. It only takes a few seconds longer.
Well, we can learn about it at the Health Expo. The Health Expo coming up this Friday and Saturday. We'll have a booth there with Intermountain Medical Center. You'll have a whole thing to, if you have any questions, you can ask the experts at the Health Expo coming up this Friday and Saturday at the Southtown Expo Center. Thanks so much for being here.
Well, thank you.
By the way, I'm 1 year out. I finished radiation a year ago on the 5th. So I'm a year out of treatment, and thanks to this guy.
And in December, it's going to be 2 years out.
2 years out. Okay. So, Ron, back to you.
All right. Incredible.
That's great.
Still ahead here on 2 News.